Thank you, Ray, for being part of our Talent MBA Expert Series today.
Yeah, thank you, Pedro. Really excited to be here. And yeah, it's always great to connect with you, given our history together.
That's
Yeah.
right. And for full disclosure, you and I kind of were two ships passing in the night when you were, I guess, just working at Siemens Management Consulting.
You were the one who recruited me for my first internship when I was in business school, and I think that summer I can't remember. I feel like you were still there that summer, but then when I joined full time, maybe you
Yes,
were already gone. Yeah.
that's exactly right. I was there for the nice, sort of introduction, and then when you
Mhm.
came back at full time, I hadn't really left. But listen, I'm going to ask you the same question I like to ask all our guests, which is, tell us about yourself, your background, and what made you decide to become, an entrepreneur, a startup founder.
It wasn't necessarily a decision to become an entrepreneur or startup founder. It was more, if you look at my background, it's always been in healthcare. So even from early days in undergrad, I was in electrical engineering, but I was really focused on medical imaging. Took my first internship at GE Healthcare, and then continued on to grad school. And in grad school, I was focused on DNA sensing. Everything was related to biomedical applications. And becoming an entrepreneur and founder was maybe more of an opportunistic situation where one of my friends had developed this technology at UC Irvine. Her name is Michelle Kine. She's a professor at UC Irvine. She became a prolific inventor, and so it was really like 20 years later we were having a conversation, and I realized the potential of this technology. They were already working on starting this. Spinning out this technology that they developed for continuous non-invasive blood pressure monitoring, and then talking to me, we just felt like, hey, this is amazing, and so that's how I decided to join them as a co-founder of the company and lead the company.
So, one of the things I did for, preparing for this conversation, I did a little bit more research on the medical device community, and I came across a young medical device company based in Washington State called Kestra Medical Technologies, which recently created a defibrillator as a wearable device that can send an alert to emergency medical service operators after a defibrillation shock. Obviously, these devices save lives. Tell us a bit more about the medical benefits and the life-saving potential of the products of your company.
So for our technology, we make a small wearable device that monitors blood pressure continuously. Now, blood pressure is one of the most important vital signs, but really tools today for monitoring are limited. You have your cuff, which is really just giving you snapshots in time, even though our blood pressures are constantly changing. Today, the only way to get continuous blood pressure is through an invasive procedure called the arterial line, and you literally are stabbing a catheter directly into your artery in order to do that. And so for our but it's important, and that's a that technique is still being done more than 8 million times just in the U.S. alone each year. So that's just in the U.S. alone, and it's because we do need to monitor continuous blood pressure because if you think about a critical care scenario or in the operating room, patient is in surgery. Well, a lot of things can happen during that procedure, and you don't want blood pressure to tank. If blood pressure drops rapidly, then you're not perfusing enough blood and oxygen to your organs, your brain, and you could have stroke, you could have brain damage, you could have there's organ failure. There's a lot of risk, and that's the reason to be able to want to look at continuous blood pressure. So one of our first applications is directly in the operating room ICU, so that we can actually be there for more cases where we can actually track this continuous blood pressure without needing to do that invasive procedure. So definitely improves outcomes. Another area that we're getting into right now, our second market we're going after, is in sleep monitoring. Now, sleep you wouldn't normally think has a relationship to blood pressure, because today sleep is measured based on sleep quality, and also sleep disorders such as sleep apnea, where you're looking at how many times you stop breathing in the middle of the night. Well, the relationship is actually pretty strong, because if you think about it, hey, if you stop breathing, well, that just means your body has to work that much harder to recover that lost oxygen. Your body goes into the sympathetic response, which is really like another way to say it is a fight or flight mode, where blood pressure shoots up to deliver that lost oxygen to the rest of your body, to your organs. And so that surge in blood pressure, nobody's been able to measure in the past. It's something that, if you think about it, you're not going to put an invasive procedure on somebody while they're just sleeping at night. And then the cuff, is only intermittent. And not only that, it also interferes with your sleep. So every time it squeezes, it's going to wake you up and disturb your sleep. So, but for us, our device, our technology, we can actually track these surges. And what we're finding is that it's not just in the order of it's not always just like 10, 20 millimeter mercury surge. Like these surges could be 100 millimeters of mercury, 130 millimeters of mercury. And so if you think about that, that's a lot of extra stress that's placed on your cardiovascular system. So that's what we're actually now able to measure. We presented at a couple of clinical conferences, American Thoracic Society. We had an oral presentation where we really demonstrated and showed that, hey, this is something that has a true impact to cardiovascular outcome, or potential for impact to cardiovascular outcome, where nobody has had this metric before. And so it's a really amazing tool that can be used to diagnose patients that are at risk of condition, to better treat these patients, personalized level of treatment based on, hey, how much are they actually surging, and better evaluate different techniques for treatment, whether it's CPAP or whether it's positional changes in sleep, or oral appliances that pull your jaw forward. There's a lot of different therapies out there, but our tools for evaluating effectiveness are, again, limited, whereas when we throw in our device, we can actually have a lot more richness of information to make more informed recommendations, and then lead to better management of chronic conditions such as sleep disorders, like sleep apnea, or even other types of sleep disorders as well.
So launching a medical device startup is typically very labor intensive, with clinical trials needed before it goes to market, not to mention the lengthy timeline for FDA approval. So what is your current strategic thinking as you build your business over this long stretch of time? And what are some of the business milestones that your team anticipates, say, in the next 10 years?
When we embarked on this journey, we knew that it would take time to develop the technology. It would take time to test the technology. It would take time to really be able to gain clinical adoption towards the technology. And we have to go through, of course, the regulatory process, which is there for good reason. Now, in terms of our key milestones, looking ahead in the next 10 years, the first milestone, which we're hoping to achieve within the next 6 months to a year, is getting that FDA clearance. And that FDA clearance specifically to be able to be in the hospital, to be as good as the invasive arterial line, which we're doing all of our head-to-head comparisons. And we've done more than 300 subjects in the OR, actually about close to 400 by now. So I would say that's our first upcoming major milestone, is getting that FDA clearance. From there, it'll just be the next one is going to be clinical traction, being able to demonstrate that hospitals would be willing to use this, because it is faster, cheaper, and more reliable, and more accurate even than the current approaches that they're using to monitor blood pressure. And then we also, in parallel, I mentioned sleep. We are looking to do our FDA clearance. That will be our second one in the sleep monitoring space. So that's going to be on the roadmap in the next within the next 1 to 2 years is our plan. We'll have that sleep FDA cleared device, and then from there we'll want to also launch into the sleep space. We also see maybe 3 years down the road, we're looking at a consumer product as well. So there's quite a lot on the roadmap.
So your education background includes electrical engineering and biomedical engineering, and you spent several years in management consulting and also product management roles. What insights have you learned about creating and growing a business as you collaborate with other leaders on your team who bring their own set of expertise to the business enterprise?
Yeah, absolutely. I think the team is really the key word here. You can't do it all, and it's not possible. In my role as CEO of the company, it's really one of my biggest jobs is finding talent and identifying talent, finding talent, and then also nurturing the talent, and being able to help our team grow to be able to achieve what we want to achieve. And it really does take, for our team, we have 13 full-time employees. More than half of them are PhDs with their experts in their respective domains. And it takes a lot to build a medical device like ours, where we're not talking about just a sensor. That sensor is a mix of material science technology, electrical engineering technologies, mechanical aspects to it. There's a whole assembly around it. So, and then we also have our algorithm engineers, our data scientists, and we have our we have also our quality people and our clinical folks. So there's so much that goes into the technology is very interdisciplinary. In order for workforce development, we have to think about it from a perspective of how do we balance this? When are we ready to bring on the next hire? When are we needing to, hey, just put on a different hat and roll up our sleeves and figure it out ourselves with the team that we have? And that's almost like a daily type of conversation, or, in terms of, hey, how is this something that we need external support on, or is this something that we really need to build this competency in-house? How do you balance that with the time and resources that we have? And so, yeah, I don't think I have the answer. We're constantly struggling with that, and we're constantly making decisions on that. And we've been successful, and we've also had failures on that as well. But I think that's part of the journey of, hopefully we're getting better and better at it, and recognizing, hey, how do we, source talent in more efficiently, and how do we grow our talent as well more effectively?
Yeah, that's a good point. And the only insight that I can say about that is, whether you're a large organization or young organization like yours, is never wait for a crisis to interject the need for talent. Talent, it's going to be needed. And if you can anticipate your growth, bring them in as early as you can and let them grow with this culture that you're creating. And they'll be there at the ready when you're ready to pull the trigger on the next, project and so on. Ray Liu, this has been a fantastic conversation. Good to see the success that you've started with, Vina Vitals, and the growth path that you have planned is really exciting to see. And obviously it's going to benefit a lot of people.
Thank you, Pedro. It's always a pleasure chatting with you.